let people in. Hello, everyone. I'm so glad that you're here. I'm Paula Heller Garland. I'm a senior lecturer and the coordinator for the Addiction Studies program here at the University of North Texas. I'm also the PI for the Recovery to Practice grant here at UNT, and that is who is sponsoring this webinar today. And wanted to tell you a little bit about upcoming events that we have during Recovery Month in September. We hope to see any of you at any of the recovery rallies that are traveling all throughout Texas in this month. We are going to be sponsoring webinars each Wednesday. So today and the next 2 Wednesdays, we'll have one at noon. And on the last Wednesday in September, we'll host a recovery symposium, which is like a webinar, but it's in person. And it will be a couple of hours, but we're going to have an online option for people who can't come to Denton. And more information about that will be announced on our website and our social media pages and groups and the periodic newsletters that we send out. And you can keep up with all the Recovery to Practice activities through our public Facebook page or by joining our private virtual community on Facebook. And I will drop that link in the chat in here just a minute. But before I introduce our presenter, I just want to share a few housekeeping items with you. Make sure if you would like a certificate for the free 1-hour continuing education unit for this webinar, that you drop your first and last name in the chat right now. I'll try to remind you a couple of times during the webinar if I haven't gotten one from you. And before we end the webinar, I'm going to send out 2 links. One is for the survey for this webinar that we are required to send out for continuing education certificates. So if you do want a certificate, you have to fill that out before you get the certificate back. And then the second one is the link for the SAMHSA survey. And we definitely encourage you to complete that survey so we can continue to enjoy these and all of our other activities through their grants and support. You will receive a follow-up email with links to the recording and to the survey if you also share your email with me in the chat. And about 10 minutes before we end today, we will have a question and answer, and the presenter welcomes your questions. You can, at that time, just unmute and ask them, or you can type them in the chat and I can read them for him. Our presenter today is Jordan Smelley, and Jordan's presented for us in the past, and his topics have been pretty popular with our attendees, so we're very excited to have him here. He is a mental health peer support specialist in Texas. He's a person in long-term recovery from intellectual and developmental differences with co-occurring mental health challenges and sensory processing disorders. Jordan defines his own recovery in relation to opportunities available to present and educate the community on topics around supporting individuals with IDD. And he prioritizes his ability to advocate for himself and for others, as well as find robust resources to address ongoing issues that may be present. And I can tell you from the places I've heard him speak and the people that he's been able to work with, he does a great job advocating out there for folks. So I want to go ahead and turn everything over to Jordan, and I am here as support for anything that people need throughout the webinar.
Okay, thank you for the introduction. So let me share my screen. All right, can you all see my screen? Yes, no, yes, okay.
I can see it. I can see the whole thing though, Jordan, not just the slides.
Oh.
I can see your next slide too.
Then we want to do that.
Okay,
Did
there you
that
go.
fix it?
It fixed it. It's perfect.
Okay, cool. All right, so today we're going to be talking about how to supporting neurodivergent persons with behaviors related to 2 forms of sensory processing disorders. Before we get into today's topic, I did want to put a disclaimer. So due to the topic of sensory processing disorders and their associated seeking behaviors and avoidant behaviors not being covered very often within the behavioral health and substance use fields and or among the recovery community at large, some of the material and or examples used may be triggering to some attendees due to topics like suicide or other thoughts caused by trauma neurodivergent persons endure, or discussion of some types of behaviors persons without neurodivergent diagnosis find odd, like tickling or play wrestling. Triggering attendees is not the purpose of this presentation. However, the way the material is presented, including the personal examples shared, are to help make sure attendees understand this very important topic in order to help reduce the trauma that neurodivergent persons endure and increase the chances of neurodivergent persons getting the supports and understanding from neurotypical peers and providers they vitally need to enter and maintain long-term recovery. So, key purpose. For the purpose of this presentation, IDD will stand for people that have a diagnosis that falls under the category neurodivergent. And basically what neurodivergent means is differing in mental or neurological function from what is considered typical or normal, as well as having when you're talking about neurodivergent persons, these are people that have things like autism, one that a lot of you are, which is one y'all are probably familiar with. Another one y'all are probably familiar with is ADHD. ADHD is actually a neurodevelopmental disorder. It is not classified as a mental health. It's classified as a neurodevelopmental. And that's, I think, where a lot of this issue comes into play when we're talking about behavioral health and substance use treatment, because it's typically the patients that have ADHD that their needs are not always met because the field and the recovery community don't fully understand. So when I talk about IDD, it's people that are neurodivergent, but also have co-occurring mental health and or substance use challenges. So key objectives. So first, we will define what neurodivergent means by giving some examples of diagnoses that fall under the category of neurodivergent, which I just gave y'all a couple. Better understand proprioceptive dysfunction and tactile dysfunction and how the associated seeking behaviors and avoidant behaviors for both types of sensory processing disorders. Why is it important for mental health and substance use providers and treatment centers, as well as peer support specialists, to identify and support or refer patients to vital supports to address sensory processing disorders like proprioceptive dysfunction and tactile dysfunction? And why is it so important for members of the recovery community at large to decrease their level of bullying, taking advantage of, and or mislabeling the intention behind some behaviors their neurodivergent peers use, and increase their level of understanding and support? So what are a few examples of neurodivergent? ADHD, Asperger's, which is now included under autism spectrum disorders in the DSM, autism spectrum disorders, cerebral palsy, and Chung-Jansen syndrome, which is what I have, but I also have ADHD. So what is proprioceptive dysfunction? Proprioceptive dysfunction is issues with body awareness and understanding one's positions in space. People with proprioceptive dysfunction can exhibit seeking and or avoidant behaviors attributed to proprioceptive sensory signals. One example would be bear hugs. So now that we've defined what is proprioceptive dysfunction, now we're going to talk about the seeking behaviors, and then we'll get into the avoidant. So what is proprioceptive seeking behavior? Proprioceptive seekers crave sensory stimulation via movement, pressure, and physical contact with others. Seekers may seem to need constant stimulation. However, they tend to become more deregulated as they take in more input. Many seekers experience symptoms associated with attention deficit hyperactivity disorder, ADHD, such as low impulse control, inability to focus, and behavioral problems. So when we're talking about seeking behavior, so those with proprioceptive seeking behavior may bump or crash into people or objects on purpose, enjoy rough play, and constantly seem to be wrestling with siblings or friends, tend to stand too close to others or touch others without permission, and crave bear hugs, holding hands, and other kinds of physical pressure. So when we're talking about proprioceptive seeking behavior and those that have this and are displaying this behavior, basically what they are seeking is more signal input. And the only way they know to get that is by activities that they find that helps them feel calm, or it's kind of like your body knows what you need, because this is me. I have proprioceptive seeking behavior. Um, and so, for me, when I'm seeking, like, wrestling with my friends, or wanting to hug, really squeeze tight type of bear hug, when those things happen, the way my body processes that, it helps, it does a few different things depending on what it is my body says that it's needing. Um, for me, when I get bear hugs and that's what I'm seeking, typically that's when I'm overwhelmed or in distress, and that extra pressure kind of helps soothe me and calm me. When I'm, trying to, like, be extremely silly with friends and, like, wrestle with them, that's typically to help me with my attention span, because I'm struggling with paying attention, and I'm also trying to be aware of the situation and make sure that my friends are also having fun. And so when we're talking about these behaviors, it's important to keep in mind, especially for behavioral health and substance use providers, that when you're seeing these type of things, you need to take notice, because what can happen is, and we'll touch on this a little more here in a second, but what can happen is, like, for example, for the longest time, I did not understand that there is a social norm for how close you stand to someone. That is something that had to be taught to me. And until that was taught, that was always an issue. And so if you're not paying attention to these behaviors and asking them why, then you're depriving them of the opportunity to get the support to learn when these type of behaviors are appropriate and not appropriate. So how to support proprioceptive seeking behavior? Assign tasks that put pressures on joints such as carrying groceries or laundry. Encourage safe climbing, jumping, and contact games. Use a weighted blanket and deep pressure therapy when needed. Give hugs, cuddles, and or other kinds of physical contact when asked, and appropriate for the relationship between person seeking physical contact and person giving physical contact. And I put that there because I do understand some of you that are here and people within the mental health and substance use treatment world, you have ethics. And for some of you, your ethics kind of prevent physical contact. However, if you're ignoring this support need, then what will happen is the person will seek it in other ways. And that is what potentially can lead to an addiction to sex, technically. Because what can happen, and this will probably make a little more sense when we talk about tactile dysfunction. What can happen is the person is seeking certain input, and when they have intercourse, that is one way that their body gets the input they're looking for. However, if you're not addressing that and making sure that they have other coping mechanisms to help them when they're, maybe overwhelmed, or they can tell they're having a hard time focusing and re-energizing, then it can lead to an addiction developing. And so you're doing more harm than good by ignoring these type of behaviors and referring to appropriate sources. So, however, do not be surprised if you need to teach the different relationships where physical contact like hugs, cuddling, etc. are and are not appropriate, and be prepared to teach or refer to appropriate support for teaching this important concept. One resource might be social skills therapist. So like for teaching people how to hugs and cuddling and like physical contact and the different types of relationships where that is appropriate, social skills therapists can help with that. Another potential resource would be occupational therapist, especially for support with proper use of weighted blankets and or vest, which by the way, that's what I'm wearing. The black thing y'all see on me is my weighted vest. I know it looks like a mini bulletproof vest probably to most of you, but it's actually a weighted workout vest that I got at Academy because I could not find a weighted vest that you would typically think of that would fit me. And the other thing I will say about weighted vests and weighted blankets from my research is you typically want the weight to be 5 to 10% of the person's weight. However, it also needs to take into consideration what is comfortable for the person. Like, for example, for me, with my weight, 10% would be 50 pounds, or no, not 50, 40 pounds. And right now, what I have on me is 24. But 24 is what feels comfortable to me and what kind of helps me feel able to better focus. All right, so we've talked about seeking behavior. So what is proprioceptive avoidant behavior? So proprioceptive avoiders are highly sensitive to movement and pressure tend to become overwhelmed or distracted by physical contact. Avoiders often have extreme or upsetting reactions to even very mild stimulation. As a result, they can appear withdrawn or defensive and have trouble fitting in with their peers. They also frequently experience symptoms associated with anxiety disorders and engage in repetitive self-soothing behaviors. So for the repetitive self-soothing behaviors, one example might be rocking back and forth. Another one might be lightly running their fingers up and down their forearm to kind of help self-soothe. However, the repetitive self-soothing behaviors could potentially also be negative, and that is why it is so important, especially within the treatment facilities, that when people are have a history of repetitive self-soothing behaviors, that is looked at and considered whether or not they are having issues with sensory processing, because some of the repetitive behaviors could be banging their head. It could be cutting themselves. And so these are things that sometimes when you don't have a diagnosis of autism aren't picked up as a sensory processing issue. And so the supports needed aren't provided. So when we talk about proprioceptive avoidant behavior, avoiders may avoid physical contact with others, appear very timid around peers, and avoid physical play, become anxious in crowded spaces or when standing even somewhat close to others, be unable to properly assess risk in their physical environment. For example, they may believe they can fall into the small gap between the floor and an elevator. So when we're talking about the avoidant behaviors, it's important to understand that when you observe these, that they are things that you seriously take into consideration in a treatment plan. So how to support proprioceptive behaviors. Warn family and friends ahead of time that hugging and touching is not desired. Give verbal cues regarding your surroundings and properly contextualize the risks. There is a gap in the floor by the elevator. It is smaller than your foot. You cannot fall in. Let's step over it together. All right, before I get into tactile dysfunction, the other important thing to know when we're talking about proprioceptive dysfunction, whether it's seeking or avoidant behaviors, is people can display both. So there may be some environments where they display seeking behavior, and there may be other environments where they're displaying avoidant. For example, for myself, I do not like large crowds. Uh, I do everything I can to avoid them because that is a extremely overwhelming situation for me. However, on the flip side, that does not apply when I am presenting. But at the same time, when we're talking about seeking behaviors, I kind of already touched this because when I am overwhelmed, one of my coping mechanisms that I will use, and I have learned I need to use it with people that are comfortable providing this support to me and not just expect people to provide it when I ask, is the bear hugs. And so you have to understand that when we're talking about the sensory processing, and there are other types besides the two types we cover in this presentation, people can display both the seeking and the avoidant. All right, so what is tactile dysfunction? Tactile dysfunction, so people that have tactile dysfunction feel certain sensations more strongly than most people do. And they will also exhibit seeking and or avoidant behaviors attributed to tactile sensory signals. So example for this one would be tickling. So what is tactile sensory behavior? Tactile sensor seeking behavior. Tactile seekers are desensitized to touch and crave sensory stimulation via specific textures, temperatures, and deep pressure. Seekers may seem to need constant stimulation. However, they tend to become more deregulated as they take in more input. Many seekers experience symptoms associated with attention deficit hyperactivity disorder, ADHD, such as low impulse control, inability to focus, and behavioral problems. So remember how I was earlier talking about how when people with sensory processing disorders don't get the support they need, it could potentially lead to an addiction with sex, and how that might make more sense when I talk about tactile dysfunction. So what can happen, and this kind of helps more broadly demonstrate this, is people who have tactile dysfunction and are displaying seeking behaviors. What happens is they sense the stimulation, but what is normal to most people is very, very mild to them. However, what happens is their brain picks up on it and likes the sensation it gives to them, so they seek more and more of that stimulation. So what can happen, and why it is so important that this is considered in mental health and substance use treatment, is people will find unhealthy coping mechanisms, and if they or they'll find one that works for them, but if they the supports to understand, you know, the different relationships where that type of input is appropriate, then they'll just keep using it. And so eventually that'll just lead to them constantly seeking. And if they don't have various ways to get the same and seeking sensory and seeking behavior, it's feel good. So if they don't have multiple ways to get that feel good sensation from stimuli, then they will constantly seek out that one thing. And that is how addiction can happen. So whether it's alcohol, whether it's drugs, whether it's sex. And so that's why it is so important that sensory processing disorders are considered when you're treating people with neurodivergent people, not just people with autism, but with other neurodivergent conditions like ADHD. So tactile seekers may prefer toys, clothing, food with very or specific textures. Constantly touch or fiddle with clothing, surfaces, or other objects. Crave hugs, kisses, and other frequent or prolonged contact with others. Tend to play too rough and accidentally harm others while playing, and have difficulty recognizing and respecting others' personal boundaries. So the interesting thing is proprioceptive dysfunction and tactile dysfunction are interwoven in a way, because you have to understand with the proprioceptive dysfunction, even though it's more about body awareness and where your body is in space, you still have that craving for deep pressure and physical contact. And so when you have people that have both tactile and proprioceptive, that seeking behavior can be more intense. And that is typically what will lead to things like neurodivergent persons being bullied by neurotypical peers. And so what can happen when, you know, the bullying happens and the teasing, you know, and I know this might not be too comfortable of a topic, but it's extremely, extremely important that y'all understand this. So what can happen is you have to understand when people with neurodivergent people with sensory processing issues don't understand that what they're experiencing is a sensory processing issue, then they kind of tend to buy into the labels, like that they're weird or they're a perv, they're trying to just get in my pants, or accept, accept. So what happens over time, and can and does happen over time, is it wears the neurodivergent person down. And this has happened to me, multiple times before I started getting the support I needed. And it leads us down a very dark path to where we're hopeless. We feel that we'll never fit in. You'll hear terms like, I'll never fit in. I don't belong anywhere. I feel so alone. And, if this goes on long enough and you're not intervening and providing the support they need, eventually it will lead to them attempting suicide, whether they're successful or not. Fortunately, in my case, I survived several suicide attempts, and all of them were from, you know, being treated differently and being accused of things that weren't true just because of the different behaviors I have. And, during this period of my life, I didn't understand that I was having issues with how I process things sensory wise, so touch and tactile and proprioceptive. And so I really didn't see, there were many, many times that I did not see the point of going on. Um, you know, Things kind of got so low for me that I actually attempted suicide while in a psychiatric hospital. And that is what led to me being committed to the state, which is where I finally started getting the supports I needed. And once I started getting the supports I needed, I started improving. And that was, I was in state hospital February 2015 through March 2015, so about a month. But when I got out, I was doing much better and had something to build on, and I kind of sort of understood things a little better. And, as I've kind of been in recovery since then and maintained it, I've learned more and more and kind of gotten to the point where I'm able to present to people on sensitive topics like this and other topics. And it's all because I finally started getting the supports I needed to address all my issues. And that included the sensory processing issues, not just the issues with my ADHD, my depression, and my anxiety. Oh, and then they have a higher norm. When we're talking about tactile seeking behaviors, people with tactile seeking behaviors also have a higher than normal pain threshold and might not notice minor injuries. I can attest to this. It is very common for me to, unless I like severely sprain my ankle, not know I did it until about 2 or 3 weeks later. So, when you're starting to see people when they're exhibiting behaviors that aren't normal, sensory processing disorders is where one place you need to be looking. So how do you support tactile seeking behavior? So use fidget spinners, stress balls, and stretchy bands. Provide a variety of textures in toys, clothing, and food. Play with finger paints, Play-Doh, sand, and other messy objects. Build a sensory table at home and include water, sand, Legos, or other textures. Place Velcro, stickers, or fidgets in study areas to help your child stay focused. And practice ways to respect personal space while eating, playing, lining up, etc. So the sources that I used for some of my information was written for youth, because typically sensory processing disorders, if they're are picked up during youth. They are not typically picked up adulthood. And so that is why it is so important. Another reason why it's important when we're talking about behavioral health and substance use treatment, especially for adults, because a lot of substance use and mental health treatment is for adults. And I know there's a lot for adolescents as well. But when we're talking about adults, this may not be as easily thought of as it is for youth. And I also know for me, Play-Doh helps me, and sand. I don't know why exactly, but just the way Play-Doh and sand feels between my fingers, it's very soothing and calming. And then if I'm having a hard time focusing, it helps me focus more. Another behavior that I didn't put in here that I know of because I have it, that people that are neurotypical or providers may not think of as processing symptom or sign of processing sensory processing disorder is, for some people with neurodivergent people, running their finger through someone's hair can be very soothing. Another one could be lightly having their back scratched, because that is a very soothing thing for me. It's also really energizing. And so basically, when you're talking about tactile, since tactile dysfunction, we're talking about impairment in the way the body processes touch. And when we're talking about seeking behavior, it's because it's lower than what it would be for issue. And so what's important is making sure the person is equipped with different ways to meet what their body needs so that they have multiple ways to get the stimulation that their body is seeking. So when you're doing role play, you could also include the different relationships where contact, like tickling, back scratches, massages, etc., are and are not appropriate, or refer to appropriate support for teaching this important concept. And when you're teaching this concept in role play, I'm not saying therapist or provider be the person to, you don't have to, when we talk about role play, that doesn't always mean like actually acting it out. Sometimes role play can be just verbal and talking about how a situation goes and teaching the person, if it goes this way, then that is acceptable. But if this starts happening, then it's not. And so again, resource would be social skills therapist, or when we're talking about tactile function, occupational therapists also help with this. Occupational therapists, when you're talking about tactile, are typically for when people are writing really too hard, they press too hard and don't realize it. And so the therapist kind of helps figure out different ways to address that. And I know this because I went through occupational therapy in my childhood, and we focused a lot on my writing and using putty to kind of help me, but not necessarily the physical contact, because I guess at that point in my life I wasn't expressing that type of issue. And that's the other thing to understand with sensory processing disorders. The behaviors can change over time. So as people learn how to address behaviors and are get effective at it, the other behaviors that may not have been an issue previously might then become a issue because they don't have as many coping mechanisms. All right, so what is tactile avoidant behavior? So tactile avoiders are active to touch or temperature and tend to become overwhelmed or distracted by everyday tactile input. Avoiders often have extreme or upsetting reactions to even very mild stimulation. As a result, they can appear withdrawn or defensive and have trouble fitting in with their peers. They also frequently experience symptoms associated with anxiety disorders and engage in self-repetitive soothing behaviors. So tactile avoiders may avoid clothing or food with specific textures, dislike being touched, hugged, or kissed even by parents, dislike their hair or skin being wet and avoid swimming and bathing, refuse to wear tight, scratchy, or uncomfortable clothing with seaming or tags, and become anxious in crowded spaces or when standing even somewhat close to others. And they also have a low threshold, pain threshold, and respond to even light touch as if in pain. So what this looks like, those people you see where even if you put your hand on them, they just like freak out completely about it. There is a chance they have tactile dysfunction. And then for those of you in treatment centers, because I have seen this in treatment centers, because I have been in behavioral health treatment centers, when you have patients that come in, and this is something that was never considered for people that weren't autism, when you have people come in and you give them clothes or a scrubs, and they're constantly taking it off, it could be they have a tactile sensory processing issue. And whatever that scrub is made from, they don't like that texture. And so they're being very overwhelmed. And so the only way they know to get rid of it is to take it off. So I know in a lot of treatment centers, you'll get patients that take their clothes off, and this could be one reason why. And if it's not addressed, then it's just going to keep happening. And what you do by not addressing it or take this into consideration is traumatize the patient, because all you're doing is repeating the input that they don't like. And so you're just traumatizing them. And that kind of goes the same for people who are huggers, like, because not everyone that enjoys hugs has tactile sensory dysfunction or proprioceptive dysfunction. You know, some people like hugs, and that's okay. But for those of you in the recovery community, when you see this kind of behavior, like they're freaking out, and you hear people say that they don't even like being touched by family, this is probably why. And this is something that needs to be respected. Just like for the opposite with seeking behavior, for people that seek that kind of contact to the point that it seems abnormal to you, I'm not saying that you have to put up with it, too bad, so sad. What I'm saying is be understanding and offer to support them with what they're seeking. And if, like, for tactile seekers, if what they're seeking is more sensory input because they need to be de-escalated, or they're trying to help with their focus, is kind of help them figure out different tools or mechanisms they can use to help them meet that. And if there are things that you can't do, it's okay to tell them that you can't do that. But it's not okay to just tell someone you can't do that, especially if you're a provider, and not offer the support of finding somewhere that can help address that need. And that is what is currently happening within the behavioral health and substance use field when it comes to treatment. People come in with ADHD, with or without substance use, and they'll exhibit behaviors, but they're just ignored, or told, the person's told, that's not normal, you can't do that. And instead of trying to understand, it's just ignored or made out to be the person's the problem, and they just need to change. And when you think about adding coping mechanisms, technically the person isn't changing. The way they address their need is what is changed. And that's how it needs to be communicated and dealt with. All right, so how to support tactile avoidant behaviors. So remove tags from clothing and turn on uncomfortable items inside out. Put long hair up in a towel or hair tie when bathing or swimming. Buy compression or athletic clothing to wear under loose or scratchy items. Use gloves or tools to engage with new or unpleasant textures. Encourage low contact outdoor games such as racing, tag, or tug of war. Please do not do that if they have the issue with physical contact, because if you do that, you could do more trauma than or more harm than good. Warn family and friends ahead of time that hugging and touching is not desired. So why is it important to keep all this information in mind? Number one, it helps establish and maintain an environment where the individual feels included and supported. Number two, it decreases the chance of the individual's sensory system being overwhelmed, which can lead to a major increase in their anxiety level. And this could also lead out to behavior within the treatment facility or out in the community. Provides the individuals the opportunity to realize they can accomplish anything they put their mind to. helps support the individuals in their recovery, reduces the possibility of traumatizing and or re-traumatizing the individuals, and last but most importantly, provides those with sensory processing disorders like proprioceptive dysfunction and tactile dysfunction the support they need to function and not be taken advantage of and or traumatized from being labeled as predator, perv, weird, etc. This also helps to ensure the trauma is reduced so the rate of attempted suicide and suicides goes down instead of up. So this is my resource slide. So I'm gonna leave that up for a few seconds since it's recorded. So that way, if people wanna take a screenshot when they watch the recording, or if any of you wanna take a screenshot right now, you can. And then we'll now open the floor for questions. And this is my website, which has more information about me and opportunities that I have participated in, and then my email and my phone number.
Kurt, if you want to either unmute or put it in the chat, either way.
That wasn't my hand. That was just applause.
Oh, I'm so sorry.
But that gives me the chance to do it verbally. Thank you, Jordan.
Mm-hmm.
If anyone would like to ask Jordan a question, feel free to unmute, or if you want to put it in the chat, I can just read them. All right. Well, I wanted to take this time to thank you again for being here. And again, in the chat, you'll find the link to the surveys. Even if you don't want a certificate, we definitely appreciate people filling out both of those surveys, especially the SAMHSA surveys. Very important to the folks who fund us to do these webinars. So it's much appreciated. And if you would like to send your email address and have me add you to the list for people who get information about upcoming events, feel free to also put those in and I will get that going to him. And Jordan, we're getting lots of messages from people saying thank you for presenting, for sharing your personal experience. And this helped people understand a lot more.
Y'all are welcome.
Could you please put the link back in for the survey? I
Sure can.
had to change devices,
Okay.
so I don't have anything in my chats anymore.
Okay, I will put it
Thank
right
you.
in. No problem. There it is. I'll also put the link again to our Facebook page and our virtual community where you'll find lots of information about us.
If y'all think of any questions, feel free to email me. Oops.
And I'll include your email address and your website and your contact information in the email I send out as a follow-up to anyone who wanted a certificate or just shared their email address.
Thank you.
Kurt has his hand up.
Oh, do you?
This time it was my hand.
Okay, fantastic.
I was curious. I just coincidentally recently I heard someone bought a pressure vest, which is supposed to be similar to a weighted vest, except they can inflate or deflate to increase or reduce pressure. I was curious, Jordan, if you have any experience with that and
your strength and your courage.
what your opinion is.
I'm so sorry that happened. How did you find the strength to deal with that? And how do you keep going on a day-to-day basis?
Mute Regina, please.
Ground or stabilize someone. You could say something like, remember that grounding exercise I taught you? This might be a good time to do that together if you want.
Yeah, I heard you. I was Paula.
Try to imagine
Regina,
really
can you please mute so I can answer the question? Thank you. Okay,
Did you
before I
get the
give an
question?
answer,
Yeah.
could you repeat your question so that way I make sure I'm giving a proper answer?
No problem, thank you. So I just recently heard someone talk about a basically an inflatable vest, which is meant to do the same as a weighted vest, except you can inflate or deflate to increase or decrease pressure. So I was curious if you have any experience with that or an opinion.
No, I actually haven't heard of that before. I know of weighted vests, and that's kind of like recent knowledge. So my knowledge around different types of vests used to support people with sensory processing disorders is still, I don't know if I would say beginner, but definitely not advanced level yet.
Yeah, no problem. I expect and I hope that would be a good thing, that development is going quite fast. Thank you.
Oh, the other thing I wanted to let y'all know about weighted vests, and this just came to my mind because of the question. When you use weighted vests or blankets, and this is something that occupational therapists know more about and understand why, but typically when you use weighted vests, you don't want to use it for a prolonged amount of time, because what will happen is the body adapts to that level of pressure. And so what can happen is it's not as effective. So typically it's used for about 20 to 30 minutes. But if y'all wanted more information around that, occupational therapists would be the ones that can explain that process. That's just something that I was told during my research. And so I did want to share that with y'all.
Well, thank you so much for doing this presentation today, Jordan, and thank you all for attending. I really appreciate it. And if you have information coming to you from this webinar, I will get it out to you quickly. And we hope to see all of you here next week. Feel free to share our information with anyone.